I'm Dr. Ford, and I'm going to be explaining to you who are all the people that surround your baby in the NICU, among other people who are also in the NICU. And stick around till the end, because I'm going to tell you about somebody who you would not expect to find in the NICU. Let's baby talk. Okay, to understand who's actually in the NICU with you, you kind of need to understand a little bit about the different hospitals. All right, so there are two types of hospitals. There's your academic hospital, there's your private hospital. In your private hospital, the attendings go in, they round up their patients, and then for the most part, they usually leave after they've given their orders, they've done their exams. In an academic center, usually academicians are involved in either some type of research or education. There are trainees involved. So you come in, you usually do your typical rounds like you've seen on Scrubs and other type of ER and all those other shows. You do your rounds, you teach your residents, your interns, your medical students. There may be fellows, there may be other people. So your typical academic program has a lot of trainees. So let's talk about the different trainees that you can have in an academic program. So you have two types of trainees. You have the DO students and you have the MD students. Now, for the most part, in all 50 states, they pretty much train the same way. It is 4 years for both of them. They have to study the same anatomy, the same physiology, so on and so forth. One of the main differences is that the DOs actually treat the body as a whole, so that the diseases are part of the whole structure of the body. Also, to be able to graduate, they have to practice something called osteopathic manipulation medicine. Now, in practice, again, because it's very similar, you can take the same residencies, you can be the same specialist, whether you're a DO or an MD, and most DOs don't really practice osteopathic manipulation medicine, especially when it comes to careers like neonatology or the NICU. Now, the next group of trainees, a level up, are your residents. And that involves your interns, your senior residents, which is usually a second year or a third year residency. Within the NICU, we see, for the most part, pediatric trained residents and internal medicine and pediatric trained residents. These are basically combined specialties where they study both the adults and the kids, as opposed to just pediatrics that studies just the kids. These residencies, for the most part, pediatrics is a three-year residency, internal medicine and pediatrics is a 4-year combined residency. There are some type of residencies that are called transitional, and what they are is basically they do 1 year of, in this case, pediatrics, or they can do internal medicine, OBGYN surgery, but again, we're talking about the NICU. So they do their 1 year of pediatrics, and then they go off to complete their residency in whatever field they're studying. One example of this is dermatology. Nursing students can have several different degrees. You can have an ADN, an associate degree in nursing. You can have a BSN and Bachelor's of Science in Nursing. And then you can have the MSN, which is the Master's of Science in Nursing. Beyond that, you have a doctorate or a doctor nurse. That program takes about 4 to 6 years. The other two programs are about 4 years of training. And then finally, the other trainee that we find in the NICU is the fellow. Now, the fellow has already completed pediatrics training or internal medicine and pediatrics training, and now they're looking to become neonatologists, basically specialists in the intensive care unit, in the management of sick babies, whether you're born premature, whether you're born with a problem. And so The fellowship is a 3-year program where you go through and you learn the skills, the knowledge, the understanding, the physiology, the pathophysiology, everything that helps you best care for the patient when you graduate, when you become a neonatologist, and when you're able to really fully on take care of patients in the intensive care unit. A really important part for us neonatologists in the NICU are the nurse practitioners. The neonatal nurse practitioners, or NNPs, are an integral part of neonatology. You basically work with them 24/7. Some of them I see more than my wife because you're in the NICU when you're taking lots of calls, when you're doing your 24 hours. You're really working one-on-one, and we have each other's back. We really work together as a team. The nurse practitioner basically is the first person who goes, attends to the patient, helps out, assists. And they are functioning fully fledged, and depending on the state, they have more responsibility and less responsibility from a legal standpoint, but they do work hand in hand with the neonatologist, and many of them are my friends, really. And then you have the neonatologist, like myself. So you can see we've gone through all that training, you've worked yourself real hard, but that's now where the fun begins. You have to obviously be really careful. You're dealing with very sick patients, but you can also now speak with the families, make your decisions, come up with your plans, and use your team around you. Again, it's so important to emphasize this is such a team effort, and all the different specialties, surgery and other specialties that help you out. Really, again, it takes a village to take care of babies or patients in general, but with what I work with babies. And so it's great that we're able to do this as a team effort. I'm so grateful. I love all the people I work with. Thank you, thank you, thank you for so many times that you've saved me, helped me out, supported me. And again, I cannot do this by myself. So you guys are awesome. All right, let's move on. There's a ton of people in the NICU. You've seen it when there are rounds. Sometimes you have a room full of 10 people. Not right now because of COVID and everything that's going on, but for the most part, you'll have a big group of people. And that's because really caring for a baby, they're so small sometimes. We take care of itty bitty tiny preemies, but it takes a village, and I can't emphasize enough. We have respiratory therapists. These are specialists in the mechanical ventilation, in the management of babies that require some type of respiratory support. We have physical therapy, helps with the movement. We have occupational therapy, setting everything up, feeding. We have a lot of babies that have problems with feeds, and they're really involved to help them regulate the way they eat. We have other allied health professionals like psychology. And you can imagine, if you haven't been there yourself, being in the intensive care unit can be extremely stressful. It is an intensive care unit. And so we have, you can have a psychologist help the parents out as they're going through this very difficult time and stress in the intensive care unit. And then you have the social workers, which are extremely key to be able to help and support the families through the stay in the NICU, and then as they go home, as they prepare to go home, to make sure they have all the equipment, they have everything ready, so that when you go, you're not just sent out, but you're sent out with a whole package that really takes care of you outside. Remember I said I was going to tell you the one person you probably wouldn't expect to find in the intensive care unit. And this is pretty surprising. And that is musical therapy, or music therapy. So it's really interesting. Even though you might have an itty bitty premature infant who is 25 weeks, You might not think, okay, they're ready to listen to a little AC/DC or a little, rock and roll or whatever it is. They actually have done studies showing that even the itty bitty small preemie babies, they actually do benefit mostly from live music. The studies, and I'll put the link at the bottom in the comment section, the studies have shown that definitely some music therapy helps, but when you do live music, you actually do see some improvement in the overall environment and stress to that. Thank you so much for watching. Please subscribe if you haven't done so already. If you really like these videos, please give a thumbs up. Go ahead and put the notification button so you'll get notified as soon as I post a video. And if you have any comment, any video you want me to go ahead and address or ask or bring up, please let me know in the comment section and I'd be happy to let you know. So again, this was Baby Talk with Dr. Ford. It's been a pleasure and I'll see you for the next video.